Hi guys, it's James from Vets of Geelong, and today I'm touching on a topic which is not an uncommon question we get in the consulting room, or from time to time we have little outbreaks. What is kennel cough? Historically it used to refer to as kennel cough because dogs were in kennels, they would come out and they'd be sick after the kennels. It's been medically kind of changed to infectious tracheitis, which is its proper name now, and typically it's a disease which is 100% vaccinatable. So what that means is we as a veterinary team can vaccinate your pet on a yearly basis, and what you'll tend to find is the chance of your dog getting kennel cough is pretty much zero, or get very mild symptoms if they do. Kennel cough or infectious tracheitis is a disease. Typically it consists of Bordetella bronchiceptor or parainfluenza, and what you tend to find is the patients that present to us have often got one thing in common. They've all been around another sick dog. So typically, where are these sick dogs? What you'll tend to find is they're out and about in the park and you'll be oblivious. The dog will be walking around, coughing, honking cough, coughing up phlegm. So you might let your dog off for a run in the park and they're around another sick dog. Or they might be, the dog's gone to the groomers and they start to have the odd cough at the groomers, a little bit of saliva and so forth, and it's aerosol so it spreads. Or you might find they've been to kennels and they've seen next to their little friend in the cage beside them who starts to cough and it spreads that way. So again, highly contagious. Dogs don't wear masks, so it spreads very fast. And what you tend to find is these patients present to us in various, symptoms. If they've been vaccinated, they might just stay at home and get no symptoms whatsoever. If they're kind of overdue for vaccination, they might get milder symptoms, so get the odd cough. If they're not vaccinated, what you tend to find is they might get severe symptoms, so coughing up phlegm or white foamy stuff, that really dry honking cough. You often are in a consulting room and you hear them outside the consulting room or out in reception or even outside the building. What you tend to find in those ones often is, depending if they've got underlying health complaints, the disease might be more significant. So if you had a patient who is a bit older and had underlying heart problems or respiratory problems, they really might get knocked for six. So it's really important to remember for the older guys, making sure we keep their vaccinations up to date. The other thing you'll tend to find too is when they get knocked for six, sometimes we have to treat them a little bit differently. So some patients might come in, the vets might prescribe anti-inflammatories or cough suppressants just to reduce the irritation in their throat. Other times they might get antibiotics if they've got concern that we've got a bacterial infection or something. And depending on how they're presenting, they might get combinations of medication. That being said, if they've got underlying heart disease and it's quite advanced, and they get infectious tracheitis, we may have to hospitalise, giving them oxygen levels to kind of hold them while they're kind of getting through it. So it's all very dependent on how sick the patient was and where they're up to in their vaccination status. That being said, as I alluded to, it's 100% a vaccinatable disease insofar as if we've done a regular vaccination of the two ingredients in the kennel cough part of the vaccination, the chances of being sick is quite low. The kennel cough vaccination itself, there's a few different options available for the veterinary team on the market. There's an intranasal option, there's an intraoral option, or a subcutaneous injection. And we may pick the type of way we administer it based on the breed, because certain breeds, if we give them, for example, up the nose, it may increase the risk in a live vaccination getting a bit sick as well. So we always bear that in mind. That being said, if you're at all concerned that your dog has got kennel cough, or they've been somewhere, they're a bit sick, ring up the team, get an appointment, and we can obviously see them. We often recommend, if you're concerned your pet has kennel cough, or we're worried your pet has kennel cough, we may ask you stay outside the building until your appointment or near the car. For everybody who's lived through COVID, you know exactly what that is. But it's a case of reducing the spread to other patients and so forth. Any questions, reach out. Otherwise, I hope this has been educational and looking forward to looking after your pet soon. Take care, guys. Bye.